on the COVID-19 situation in that province. The Premier Winde there is joined as well by the Health MEC in the Western Cape, that's Nomafrench Mbombo, as well as the HOD for Health, that's Dr. Cloete. Let's cross live to that virtual briefing for you now.
Point where the infections then start slowing and decreasing. We brought this specific factor in for you today from our analysis, and that is just to show what are the characteristics of all the people that have died in this time period. And we wanted to compare in the various stages what is the characteristics. So there are 4 categories here. The blue bars represents the early wave of the first one. That's before, up until the peak in June. The orange bar is what we call the late wave 1. So that was the decline of wave wave 1. The grey bars is the period between the waves, and then the yellow bar is the second wave. And what we see from this, and that is really the point here, from a gender perspective, there's not much difference between all 4 of those periods. From an age group perspective, it's quite important to note the following, that although there is reported cases of many more people dying between the ages of 20 and 39. If you look at the overall number and proportion, the second wave actually is slightly lower than all other 3 waves as a proportion. And what it means is there is more deaths. And because there's more deaths, people know, and in the hospitals, there are more people between the ages of 20 and 39. But as a proportion of the total, it is not higher. And the same goes for all the other age groups. And then the more important thing, is there any different profile for comorbidities? And again, the comorbidities looks more or less the same. Diabetes is again the same like it was in the first wave. With this one, there's a bigger factor for hypertension. Hypertension is presented more in the second wave. But everything else, the chronic kidney disease, the asthma, the previous TB, even current and HIV positive has been slightly lower, just shows that the pattern of the death profile, the number of people, the gender and the age is very similar across all the waves. This is the provincial overview in a little bit more detail then. The one on top in the middle is the cases. Again, I just say that we need to be careful that we might not have tested as many over the public holidays. The case positivity, proportion positive on the left bottom. Then the number of admissions, just to say that the admissions are starting to show a stabilization, but it doesn't mean that hospitals are emptier. It just means that the hospitals are at their busiest peak, but the day-to-day increase is not as high as it was 2 weeks ago. And then the last one is the deaths. It's still going up, and we're watching to see that we, with the catch-up of deaths, are watching it carefully. The metro picture, in the metro, generally, there's been a stabilization of the cases, and you can see virtually everywhere, Khayelitsha, Southern, Western, Klipfontein, Mitchells Plain, stabilization. The other areas, Eastern, Northern, and Tygerberg, there's less of a stabilization, so there's still a bit of increase, but overall, it shows a stabilization. In rural, it's a very clear picture, left bottom, that Garden Route is now clearly coming out of the second wave. But then you see that Cape Winelands next to it is starting to show some stabilization. And then also Overberg is starting to show some stabilization. But West Coast is still on an increase. And Central Karoo has got small numbers. So there's a recent upswing again. And any small numbers and a little outbreak of numbers, then it keeps them going up and down because it's very much smaller than in the other areas. This is our huddle report as of yesterday again. So out of Klipfontein, Mitchells Plain, just to give you a sense that people feel that there's a plateauing and a feeling that in Klipfontein and Mitchells Plain, which is what the figures bear out, is starting to stabilize. We have our 2 wards fully operational for the Mitchells Plain Hospital of Hope. And the 3rd ward is coming online on Monday morning. Then if you look at Northern Tygerberg, there's still some cases that's increasing in that area. And the 3rd bullet is very important to note here, is that most cases that's reported there are family members in the same household or extended family members that have attended a family gathering. So we're finding now more and more that where people gather, that's where the cases starts spreading still. And we really want to make a call for keeping those units small and for people really doing everything not to spread infections, even in small gatherings. In Central Karoo, I've given you that point as well. There's lots of family clusters and street clusters. Again, it's gathering of people in small areas. In Overberg, where there's a sense of stabilization, there's also a very positive story in Overberg, in that at the Helderstroom Correctional Facility, there was an outbreak. The team responded. Everybody worked together. There was with correctional services, with the municipality, with everybody, and the situation has been stabilized without major impact on the hospital facilities. And it's really kudos to the team that at the height of where we are, that we still have a cluster response and a containment response. Then in West Coast, that's where we are feeling more and more pressure, because that's still the last area in the province where there's still an increase in cases. It had the latest takeoff, and there's still a sense that people are feeling quite a lot of pressure in this week as we speak in relation to that. So Garden Route truly has passed the second wave. So you see that the cases, you see that the admissions in hospitals, and also the deaths are all showing a downward trend in Garden Route. Scaling up our healthcare platform capacity, just to stop a little bit here again, our primary care facilities is the places, clinics where people come for testing. So there's quite a lot of pressure there for testing, but also finding cases that needs to have an oxygen to get into the hospital system. It's a very important entry point in our healthcare system. The hospital capacity, we have 7,693 total acute operational public sector beds. That's excluding the psychiatric hospitals, TB Hospital, Red Cross and Mowbray. And in this full number, we have the total general and critical care public sector beds into which COVID can be admitted. This operational bed number differs from day to day. It's dependent on the physical bed, the oxygen supply, everything that you need to run the bed, but more importantly, it's dependent on having staffing to be able to operationally look after the beds optimally. In addition to, and a part of this acute beds now, a sub-part of it, is that you will find 626 intermediate care beds is part of this operational beds of 7,600. And you will see that 336 beds of Brackengate is in there. There's 90 beds at Lentegee across the Friesie and Ward 99. And then the 200 Hospital of Hope beds that's been commissioned in an incremental fashion. There's also the 64 intermediate care beds at Sonstraal. We've brought 5 extra beds, has been added into the 59 to make it 64. And we've now opened 20 of the potential additional 136 intermediate care beds we said we had in the reserve if required and if we have staffing. At this point in time, we've brought 20 online. There's still 116 that can be brought online, but we are closely watching for this week whether the need to bring the additional 160 bed is really there. And if so, we will then bring that online. For fatalities management, that's really to deal with the bodies of the deceased. We have this mass fatality center in the metro at the Tygerberg Hospital premises. The City of Cape Town works with us, and in total, we have 336, we have space for 336 bodies at any given time in that place if there's a backlog in the mortuaries or other places. At this point in time, we have 101 bodies in that place. It varies day on day. As the death certificate is issued, the undertakers take the body, the family has the funeral. It's really a backup system to make sure that the system runs smoothly. We can really truly say that in this entire province, there's a team of people that's looked after this and has managed it with all the municipalities, and we've not really had a significant backlog of bodies at any given time during this period. Then the hospitalization trends that the Premier spoke about. If you see the green line, and that is really the key message the Premier is giving today, that top green line, that has not quite come down yet. So when we say we're entering a peak and it's a sign of stabilization, all it means is the green line doesn't go straight up with increasing demand. But it still means that all hospitals are under pressure and it's extremely difficult to get into a hospital bed. The top line is the public sector, The one just below is the private sector, and we're watching very carefully. The two lines at the bottom is the public sector, the private sector, the red one for critical care, and the yellow one, public sector for critical care. So if I have to summarize where the platform finds itself now, we had 3,323 COVID patients in hospital beds 2 days ago. It's the day before. 1,889 of that is in public sector hospital beds. The other 1,433 is in the private sector hospital beds. Again, it excludes people that's under investigation, that we don't know the diagnosis yet, and also the cases that we have of confirmed COVID in those specialized hospitals that I spoke about, Red Cross, Mowbray, and the psychiatric and TB hospitals. If you look at COVID hospitalizations, it has stabilized, not decreased, stabilized, while we continue to experience still psychiatric pressures. But the big thing that we can report is that the trauma in those hospital beds has decreased significantly. So the metro hospitals currently have an average occupancy of 93%, George 61, Paarl 74, and Worcester 73. Those are all the hospitals in the drainage areas across the province. And if you look at the COVID general beds specifically, it is then in metro, for the designated COVID beds, they're 91% occupied. In George, it's 59%. In Paarl, you see it's 90%, a little bit reflects of what's happening in West Coast. And then in Worcester drainage area, it's 73%. So all in all together, the COVID cases plus the PUI cases are currently making up 35% of all the available general acute hospital beds in the public sector across the province. At the Hospital of Hope, we have 305 people this morning. At Frisia and Ward 99 at Cape premises has 67 patients. And then the Mitchells Plain Hospital of Hope has 92 patients this morning. And in Soonstraal, there's currently 60 patients. So if we go and look at this as a total, this is the dashboard that gets updated every day. It gets updated at 1 o'clock today, but this is the 1 o'clock yesterday. You will see the 7,693 operational beds I spoke about, that as of 1 o'clock yesterday, in the public sector, there were 6,525 people in those beds. That means the occupancy was 85%. In the designated COVID areas, it was also 85%. That's kind of at the maximum of what a hospital should run at. And you will know in the weeks before we were talking about occupancy rates even higher than that. If you look at the areas, you'll see the Cape Metro is at 93% overall occupancy and 91% for the COVID capacity, where George is 61, and George is the lowest because that is the stabilization of Garden Route we're talking about. It's 61 overall occupancy, but 59% in the COVID capacity. Paarl is 74 and 90, and that's why I said the West Coast pressures and the Paarl drainage areas reflected in that. And Worcester, which has stabilized over the last week quite significantly with the Caledon drainage and the Cape Winans drainage, is 73% and 73%. If we go to the oxygen use, from this picture tells you this is what we as the public sector use out of the Kales River Afrox plant. They produce 70 tons a day. We use 70% of that 70 tons, but the balance of that 70% of the 70 tons is used by the private sector hospitals in this province. If you look at total oxygen consumption per day for the public sector, we are now running above 47 tons for the public sector per day that we use at the peak for COVID. And put it all together, the combined utilization between what we use, the 47 tons we use, plus the balance used by the private sector, at the daily use currently for oxygen is 73 tons per day. And this is slightly down from the daily use that we saw early in the week, which was as high as 74.6 tons. So there's an early sign that the daily use for oxygen in terms of tons are slightly starting even to flatten as well. But whilst we use 69% of them, in the public sector use 31%, the combined utilization, that's 73 tons, is still more than the maximum production capacity of Afrox in its Western Cape plant. They can only produce 70 tons per day. And therefore, Afrox is still trucking in additional oxygen into the province to augment those supplies. They also use 5 oxygen tankers to move hospital to the individual hospitals. And as of this morning, we can report that in, let's call it the storage tanks, the surplus tanks, we now have 90 tons of oxygen in storage. So that means at least for another day, or we're going into 2 days, buffer stock for oxygen. That's in addition to the oxygen supply that's already in all the tankers at all the hospitals. So we can truly say that out of a situation where the supply and demand was much tighter together, we are now getting into a place of generating some surplus oxygen in terms of our needs. But we will continue to monitor this as we go over the next week or two. Then scaling down the non-COVID capacity. The key issue was, what has been the recent alcohol regulation and how has it affected trauma presentations in our hospitals? We can show you this graph now because if we look at this, we can see what the situation was up until the 13th of December. There was on the 16th, from the 15th of December till the 28th of December, there was some restrictions brought in. In that period, we had Wednesday, the 16th of December. We had a weekend there over the 19th and 20th December, and then we had Boxing Day and Christmas in that period of the Monday to Thursday restrictions on alcohol. From the 28th of December, there was the total prohibition of alcohol. From that, you can see the radical reduction of cases. So this is now, we got data for the last 2 weeks, and it's a significant sustained decline in trauma presentations at the emergency centers as measured at these 5 Sentinel hospitals. And what does that look like? 2 weeks before the alcohol ban, the average number of cases seen across the 5 areas per day was 76. 2 weeks after the ban, that has dropped from 76 to the average number of trauma cases of 43. The maximum, which was recorded on Boxing Day, of 157 cases, reduced to a maximum of only 66 cases across the 5 hospitals on New Year's Day. So what does it all mean? It means that immediately after the alcohol ban, the absolute number of trauma cases decreased by 51%, 2 weeks before, 2 weeks after. And the maximum daily trauma presentations declined by almost 60%. That's from that 159 to 50 to 66. And if you then take that New Year's week 2020 to New Year's week 2021, and you compare New Year's Day specifically of 2020 with New Year's Day 2021, you will then see that the curve of trauma has flattened by 65%. 2/3 less cases on New Year's Day 2021 compared to New Year's Day 2020. And this is the experience that has been experienced by all emergency centers and hospitals, not just in the Western Cape, across the entire country. And that has been sustained since New Year's Day, that we have low levels of trauma in our hospitals. Then coming to the healthcare workers, our biggest challenge remains that our healthcare workers become infected. Minister Mbombo has gone on the record, and myself, that is probably the one biggest concern for us is the safety of our healthcare workers and the conditions they find themselves in. Also, the availability of additional healthcare workers to bring them in on contract or agency, and then people to volunteer and still to provide PPEs, but then at the same time to provide on-site support to our frontline staff, because in terms of their mental well-being, that has also been scaled up. And we've had this team of people that have gone facility to facility where staff can come out and share their traumatic experiences. The traumatic experiences in relation to personal family members passing away, themselves becoming ill, seeing fellow staff members becoming ill, landing up in hospital, passing away, and dealing with all that trauma. And on top of that, seeing patients passing away. So a lot of trauma has been experienced, and it's really on-site support to work through that trauma. So this is also now a dashboard that we now run and update every day. And we can now say from the start in March, right up until this point, that we've had 8,000 healthcare workers infected in the province. I'll come back to this because this becomes such a crucial thing to realize, that when we introduce the vaccination program, we have this program to be able to track the impact of vaccination on the staff in the Western Cape Department of Health. Almost 7,000 people, staff members have recovered. Unfortunately, 92 cumulatively to this point have died. About 60 in the first wave, and up to now, about 30 people in the second wave. So of the 1,029 cases that is active as of today, this morning, which we update every day, 98 of them are doctors. We know each one by name, and we know each one where they work. 442 nurses are active today. We know where each one work, and we know where they are. The radiographers is 23. Pharmacist is 7, and all other categories of staff makes up 459. If you take that and you break it down into a geographic area or into an institution, a big hospital, it will then show you, for instance, according to this, if I can show you now that I said in West Coast there's pressures. In West Coast, that is across all the hospitals and the PHC facilities in West Coast, we have 659 staff in that area. 51 of them, which is 7.7%, is currently actively infected with COVID and isolation. So as West Coast hits its peak, 7% of our staff is out because they're infected with COVID. If you go to Overberg, which was the highest a week ago, they have 412 staff members, and 27 of them is currently active. That's 6.5%. And if you go to Cape Winelands, out of the 2,183 staff, 131 is active. It's 6%. Now, when we look at total numbers like Tygerberg Hospital, we see 151 people are infected at Tygerberg, but they have 4,632 staff members. It is 3.2% of all their staff members. Now, we have all of this information across all the areas and then plan our deployment of staff in relation to the number of people that is out of work. So therefore, filling of nursing posts have been one of these areas. We have for nursing, for doctors, for allied, for all of them, but for nursing, we have offered 435 jobs in the last 2 weeks. 286 people have actually started, 100 in the metro and 186 in rural. And we monitor this on a daily basis as a team of people that's working around the clock to make sure we have additional staff in the system. To come to the vaccine strategy. Now, vaccine is probably the most powerful global weapon currently to turn the tide against COVID. Our National Department of Health is driving the procurement process, and we align with their efforts. The National Minister announced on the 7th the acquisition of the 1 million AstraZeneca vaccine doses by the end of January, and the further 500,000 in February. Further negotiations are currently being pursued with all other possible vaccine suppliers for more stock in addition to this. And that is also in addition to what the COVAX initiative will deliver. The Western Cape Department of Health, that's us, we are now very strongly focusing on our readiness to be able to implement a vaccination program in this province. The framework that the country is working in, and we are also working in this framework, is to be guided by science. What's the evidence informed? What's the availability of vaccine? What's the need for a vaccine? And put the evidence and the science very clearly in unambiguous terms into the public domain. The second thing is about ethics, which is about equity and justice, that the people that need it most gets it. It's about transparency. It's about maximizing benefit and minimizing harm to individuals and to populations. And then the big glass area is implementation, that we are on top of the logistics. We have healthcare worker training, we have surveillance, and we can have data and we can track, almost like the dashboard for COVID, a day-to-day tracking of how many people are being vaccinated, private and public, in this province. It will be done in phases. The first phase is healthcare workers. We are busy quantifying. At the moment, we have an estimated target of 100,000 healthcare workers in this province, public and private, and students and community health workers and people that's working in care workers and people working in the military and people working in other places that are medical, all healthcare workers, therefore. The phase 2 is other essential workers, which is police, teachers, municipal workers, and other essential workers in business, and then also clients in very crowded settings, but also the vulnerable, people over the age of 60 and people over the age of 18 with comorbidities. That is projected to be a much bigger group of people, and we also have to quantify and start working towards that as a second phase. And then the third phase is basically the balance of everybody over the age of 18, but just to note that no children and no pregnant women at this point will be vaccinated because none of the vaccines have been tested in children and in pregnant women. So our arrangement internally is that we have a structure that looks at this. I oversee, and there's a team in the health department that is doing the vaccine coordination. They do all the logistics and the planning. We've also now appointed an expert advisory committee. They meet tomorrow to help us, to advise us on all the ethics and the technical and the high-level advisory things. We're also meeting on Thursday with a private sector coordinating committee to do this collaboratively with the private sector as a unified action, rather than private and public separate, but as a unified action. And we're guided by three broad things. We need to socially mobilize people. That's communication and stakeholders. We must get the operations and the logistics right. And that is all the way about accepting the vaccines, storing them, distributing them, getting the people to do the vaccination, getting the infrastructure, and getting a model for how we're going to do the immunizations. And then information systems, being able to register everybody that needs to be vaccinated, and tracking the stock, tracking whether anybody has an adverse reaction, and then tracking progress in terms of coverage. And the dashboard I showed you about healthcare workers in the health department, we will then be able to track on a daily basis how many healthcare workers have been vaccinated per each hospital. And we can track again how many people have been infected in each of those hospitals. So we can really track the impact across our system. Then the geographic service model. We believe that in a geographic area, we need to actually look at hospitals, community health centers, pharmacies, general practitioners, and other vaccination centers, and work together towards offering the vaccination, not just for phase 1, and preparing also for phase 2 and phase 3, that we have a slick system to be able to do it well and in the best possible way that we can. The functional process will look like this. There will be pre-registration and accreditation of facilities that will provide the vaccine, but also the vaccinators that will do the vaccination. They need to have the skill and be pre-accredited to be able to do it. Then secondly, there will be a registration process. Everybody that needs to be vaccinated needs to enter onto a vaccine register. It's almost like a voter's roll. We're also talking to the IEC that does the logistics for all the voting. And we're learning from them also what systems they're using. Then each person will be given an appointment process to say, you will go to that place at that time. And when you get there, somebody expects you. When you arrive, you will sign consent. You'll get your first dose. You get your appointment for your second dose. And you will be issued a proof of vaccination. And you're registered on an electronic system that you've received a vaccine. And then you'll have the second dose, and that's the completion of vaccination. All of this will be supported by adequate supplies, the infrastructure, the skilled people, and the data systems to be able to track all of this. Communication and messaging is going to be very, very important. The Premier and us, we are very set on this, that we will give at all times honest and transparent communication to be able to build trust in relation to vaccines. The focus area here is to motivate people in all sectors of society, and it's to let's unite to vaccinate, and that all of us are in this together. The second thing is to build vaccination confidence. That is to address all the medical concerns people have. Is the vaccine safe? Will it work for the new variants? A whole lot of questions, but it's to address all of that. Then very importantly, to address religious and cultural concerns. There's a lot of concerns and anxiety that people need to clarify in terms of the vaccine. And then, very important is to address misinformation. There is very clear and deliberate via social media misinformation about vaccines that we need to, in a sense, counter with credible, scientifically based information. And then lastly, the logistics about, is it available, when is it accessible, is it acceptable, and where will you get the vaccination? Stakeholders, I've already said, it must be everyone. We started with organized labor in our department, but we need to engage civil society, business, universities, religious communities, and a range of other stakeholders. And we need to do this provincially and in local municipalities to be able to be successful. And then lastly, the information system to track the progress. Data will be such a crucial thing. And there is a national proposed computer application program that will do this all electronically. We support that system, but if there's any way that that's delayed, we will have our own local contingency plan to be able to mitigate and vaccinate and capture the data appropriately. Ideally, it should be electronically at the point of administration, and it should be uploaded into something we would call a dashboard, a vaccine dashboard, and then we can actually keep people informed as we go. So the general comment is this is a massive opportunity to build a movement for better health. It's to unite all sectors and all parts of community around a common objective. Let's unite to vaccinate, to turn the tide against COVID. It's a unique opportunity of hope that's introduced for us at this point in time. It's also to lay a good foundation for collaboration, for working together between the public sector, private sector, and civil society. And then vaccination does not replace the need for non-pharmaceutical interventions like mask wearing, social distancing, and hand washing, which we still have to maintain until such time we get herd immunity at a population level. We have to reprioritize our efforts and resources. We must act with urgency and must do it as soon as possible. And we call on everyone to join us, to work with us to make this a success. Then for the upcoming weeks, we still say, isolate when you've had contact with somebody that is symptomatic and has potentially got COVID. We also say protect yourself and others for the duration of until we have what I would call herd immunity at population level. Keep your physical distance, wear your mask, cover your cough, open doors and windows, avoid crowds, close contact and confined spaces, the 3 C's, and wash and sanitize your hands. That is got to be the way we behave until we have herd immunity and COVID is no longer a risk to our society. In conclusion, there are early signs that we've entered the peak of the second wave, with early signs of stabilization. Those are the words the Premier used. Our local teams remain on high alert for surveillance and response in localized clusters, as illustrated in Overberg in relation to the Helderstrom prison. Our biggest concern is the non-adherence to protective behaviors. Hence, we still need law enforcement intervention in line with these new regulations to make sure that we all do not spread COVID any further. Hospitalization and mortality data still points to a very highly pressurized situation, and we need to have continued vigilance to reduce new cases. We've experienced a significant reduction on alcohol-related trauma, which has then brought some welcome relief across the healthcare platform. So that has helped. But our healthcare workers have and continue to face significant physical and emotional strain and trauma. We need to provide relief for them and their families. And it's essential to have a strong focus on our behavior change to ensure containment for the next 6 months at least, while we gear up to provide access to vaccines to everyone. Thank you very much.
Dr. Keith Cloete, who is the head of department in the Western Cape Department of Health, briefing the media and his colleagues there on the Western Cape's response to the coronavirus. Some of the key points coming out of that, saying that pregnant women and children will not be vaccinated as those tests haven't been tested on pregnant women or children, detailing how the vaccine is going to be conducted with a person coming in for a jab. They'll get a certificate and also be logged electronically. Dr. Cloete speaking about misinformation, particularly on social media around the vaccine, and saying they need to counter that with facts and asking people, imploring people to be safe, saying that washing your hands, wearing a mask and social distancing are the ways to try and prevent COVID-19 until herd immunity is achieved, obviously through vaccines and non-surgical interventions. It's time for a short break. I'll be back with more news. Do stay